Imagine getting a procedure done for one thing, only to end up believing it causes side effects you never expected. Our next guest, Sabrina and Daryl, this is their story.
If anyone would have said I would be this way, I wouldn't have believed them. It just falls out. I'm in pain. I've had just a cough that won't go away. Severe fatigue. I've almost fallen asleep driving. I'm a mother of 4 children, and I have a fiance. After my 4th child, my fiance and I decided I would undergo a sterilization procedure. After discussing my options with my doctor, he recommended this new procedure known as Esure. The Esure procedure is where they implant metal coils into my fallopian tubes, and it creates scar tissue to prevent the egg from dropping into the uterus. It was 99.9% effective with 0 side effects. It was a quick 30-minute procedure and was sent home the same day. I immediately noticed that I was cramping. It was unbearable. I lost control of my bowels. It was humiliating and unbelievable. Having to rush my children in the house so that I could wash myself was awful.
There's all this damage that's happened.
Severe pelvic pain, difficulty walking, severe scarring and pock marks.
She's constantly bleeding.
And I get this just pressure, like my insides are gonna fall out. So I contacted my doctor, and he said it was normal. The side effects that I was experiencing was because of my age. I was only 35 years old. When I look at pictures from before I had the procedure, I don't remember that woman. I put on 80 pounds. I don't want to take pictures with my children. I'm absolutely ashamed.
She's just falling apart. It's just really scary.
About a year after I had the procedure, I started noticing clumps of hair falling out when I would take a shower. I don't want to be bald. I don't want to lose my hair. That's what makes me a woman. For me, having the coils removed would be claiming my life back. I wouldn't want to see anyone else in my situation.
Sabrina and her fiance Daryl are here today. Joining us in the audience is Dr. Scott Sills from the Center for Advanced Genetics and Dr. Rachel Stewart, a family planning physician. Also on the phone, we have Edio Zampaglione, the VP of U.S. Medical Affairs for Bayer Healthcare. I want to welcome everyone for being here. But Sabrina, you feel like your life has changed drastically. And I want to emphasize, in your opinion, this is all due to the device.
I absolutely believe this is all due to the device. I was completely healthy after my 4th child. I was active. I've never had any medical problems whatsoever. So I don't understand. It's just, I thought I was going crazy.
You mentioned in the tape piece that you were told it's 0 risk. There is nothing in medicine that's 0 risk. So anyone who hears that from any healthcare provider, that's the time to say thank you, nice to meet you, get up, and go get another opinion.
So Dr. Ashton, I'm going to ask you to help me here because obviously this is not my field.
Sure.
And we've shared Sabrina's story to highlight someone's specific example of you feel like your life has been turned upside down. But this is a device that is still being used. There are still strong who very much support its use. There are those that are not as in favor of it. Mm-hmm. And we have a few doctors here today who maybe have different stances on it. We're back with Sabrina and her fiance, Daryl. I want to bring into the conversation Edio Zampaglione from Bayer because I'm trying to be unbiased in hearing all these opinions. And even though I'm a physician, I'm really looking at this as much as a layperson. And I'm asking the question, is this a viable option going forward? And clearly you still stand by this product.
Yes, it absolutely is a viable option. And when you review all the data that's out there, you see a very, very consistent picture of high efficacy and a positive benefit-risk profile. There is no foolproof or 100% risk-free method. Each method out there carries certain risks, and we see that with Assure. Assure does not contain any hormones. So some of the side effects that are mentioned, such as hair loss and what have you, there's no hormones in it. These are usually hormonal related issues.
One of the things we can all agree on is making informed choices. As the patient, in your case, Sabrina, it's very obvious that this is something that you wish that you could undo. And that is something that I know is important to you. We actually sent Sabrina to see Dr. Scott Sills to evaluate her situation.
It's been a very rocky road for Sabrina. She's gone time after time to doctors that have told her it's all in her head.
My weight gain was instant. I've never been this heavy in my entire life.
There is one thing that's interesting about your situation. You can see on your left implant, there's a piece of it that's off by itself. This may be in the process of separating.
My biggest worry is I was having cramping, and when I urinated, I actually found something.
So this metal device was passed vaginally.
Yes.
Since you've had the Essure procedure, how many gynecologists have you seen?
I've seen 6 doctors.
A lot of patients would give up. She's pretty strong. You have to listen to your own body.
The last doctor, she said, you have severe masses, fibroids, so that's why you need a hysterectomy.
Well, that doctor may be right, but that's why I'd like to do an ultrasound. That'll help answer the question about the fibroids. So this is a picture of your uterus. Here's left ovary. Looks very, very normal to me. You have a cyst on your right ovary. The cyst is larger than your entire left ovary.
So, Dr. Sills, talk about the coils, if you could, and the procedure where you can remove them without a hysterectomy.
Sure, but I also need to go back about the data, if I can, because this is crucial. The device is supposed to stay in the body for a lifetime. It's a permanent implant. The amount of long-term data available for this device is maybe 12 to 18 months. So we don't know what happens for a patient who's had this device for 3 years, for 5 years, for 25 years. There is no data. So regrettably, a lot of what I just heard back, I strenuously refute because we have to have that data.
So talk about your procedure.
But the surgery to remove it is very much like what we've all done to do tubal ligations, except in this instance, there's a device that's in the fallopian tube that needs to be removed intact. So the dissection at the junction point from the tube to the uterus has to be really circumferentially dissected, and then the device must be lifted out very carefully. It's quite fragile. The entire device we're talking about is only about 4 centimeters long. And so this thing is fragile, and it will fragment and become splintered. So the delicate nature of this device is something that I think a lot of patients who have had less experienced surgeons do the operation end up with pieces of the device left in them, and they still have symptoms.
I think everyone watching is understanding now why medicine is very far from black and white. There's a lot of gray there. We'll continue this discussion when we come back. Dr. Stewart, what's your opinion hearing this story, and what is your perspective in general in terms of this form of birth control, if you will?
So my personal experience, I'm a board-certified OBGYN, and I did a specialty in family planning, prevention of unwanted pregnancies. I've performed hundreds of Essures, and all but, very, very few of my patients have been satisfied. And so my experience has been very positive, and my patient's experience has been very positive.
Then to ask you, Dr. Sills, you've also had a lot of experience, but maybe from a different perspective.
Yes, the patients that I see as a fertility subspecialist are coming to see the doctor for the list of complaints that we saw portrayed on the video earlier, but they don't want to have a hysterectomy. And so many times the remedy for the problem has been to take the uterus out. And so from my experience, the patients are really looking to get their life back, but they don't want to surrender the thing that makes them most feminine, and their very essence of being a woman shouldn't be given up as an exchange to get back to the way they were before. So the extensive data and research is sadly lacking.
Can I jump in there? We actually do have quite a bit of data. Essure has been FDA approved for over 13 years. And in the 5-year clinical trial, over 10,000 women were studied using the device. There are many other choices that women have. Women have to be informed about all of them, but there's no perfect choice. So this is a difficult choice for women to make. It's one that needs to be made with consultation of a physician and with all of the options discussed.
Right.
Could I ask a question? Would you have them placed in your body?
Patients ask me this all the time. I'm very forthcoming with my contraception. I'm totally done with my childbearing. For me, an Essure would not be my first choice, but many women don't want a device in their uterus, and many women do want a permanent method of birth control. So for those women, I would recommend it.
So I think that we've heard some very valid points from all sides. You know, personally, my opinion is that, first of all, I don't think that what makes a woman is whether or not she has a uterus. I think a lot more goes into her femininity than whether or not she has a uterus. But when you talk about risk-benefit, there are many methods of permanent or temporary contraception that also carry with it the benefit of a dramatic reduction in ovarian and uterine cancer. Tubal ligation, or having your fallopian tubes only removed, or being on birth control pills. Do they have risks of clotting? Absolutely. But they are what we call chemoprevention as well, which reduce cancer risk. So it underscores that there are a lot of options. They each have their own risk-benefit profile, and this is not a 5-minute discussion.
We'll have more on this when we return. We're back talking about Sabrina's experience with the Essure device. I understand, Dr. Zampaglione, you would like to say something in response to Dr. Sills.
So Dr. Sills was incorrect when he said there's only data 12 to 18 months. Part of the approval process and commitment to the FDA was a 5-year post-approval follow-up study. That study was completed around 2007, 2008, was submitted to the FDA. They did review that data and found no evidence or no indication that there were any kind of signals or problems with the device. And there was actually another study that was published in 2014 that was a 10-year follow-up study. Now, that was a database looking at the MAUD database, which is the FDA's adverse event reporting site. And again, very much showed that there were no signals, nothing to indicate that there were problems. So the data is out there, including long-term data.
And so one of the important things to take away from all this discussion is there are different viewpoints on this. And I know exactly how you feel. Clearly, Dr. Sills, I know you feel. Dr. Stewart, you've made your points, as well as Dr. Zampaglione. But one of the things that's always important is we break it down to the individual patient, which is, I want to get back to you, Sabrina, because you clearly have not had a good experience. It sounds like you would do anything to no longer have this device.
I just want it out of my body. I want my life back. I want my kids to have their mom back. This is not okay. I researched this before I got it in, and there were nothing on the internet in 2012 when I got this placed. There was nothing, other than the little beautiful pamphlet that they give you that says this is a non-surgical procedure.
So, Sabrina, your feelings are, that's the one thing I will say is very clear to me. And Dr. Sills, I know that you have something you'd like to share.
Sabrina has a full plate. She's a busy mom, and her importance to a lot of people, it's hard to overstate. And when she sought me out to propose a remedy for this, it's a moving story. It's a very compelling problem that needs to be remedied. And because she stepped forward to try to teach other women about how to be a good detective, which is a huge mission to take on, we've decided to provide you that removal surgery at no cost.
Oh, thank you so much.
Sabrina, we wish you all the best in life.
Thank you.
Thank you for being here. I want to thank everyone for engaging in this conversation. And ultimately it does get back to individual choice, making informed decisions, and doing what's best for you, the individual. We'll be right back.